Hi everyone, this is Professor Demito with our weekly update for week 9. Time is flying that we're all ready to week 9. And week 9 focuses on kidney disease in the pediatric population. Kidney disease affects children in many ways. Acute kidney disease typically it happens suddenly but lasts a short time. Once you correct the underlying issue, it resolves with no long-term consequences. Chronic kidney disease, on the other hand, doesn't go away with treatment, and it tends to get worse over time, necessitating need for a kidney transplant or dialysis. Now, these children with end-stage renal disease suffer many stigmas, such as growth delays and incontinence, and delayed motor skill development. A lot of subsequent issues related to children that have these unfortunate conditions. Our objectives are as they are every week. That hasn't changed. And our readings are all specific towards kidney disease in children. Now, for assignments this week, you have 2. The first one is your clinical rounds discussion. So that's exactly what you've been doing every week. So you're going to choose a patient that you've had in clinic, and you're going to follow the same pattern that you've been doing week to week. The clinical practice scenario is a little different. With this one, this is an assignment, and you don't need to respond to anyone's post on this one. The other one you do. This one you don't. This is an individual case discussion, and it focuses on culture. Now, I want you to answer these questions with at least 2 scholarly references, and make sure that you're writing it using appropriate grammar, punctuation, and APA formatting. What are some of the different cultural practices that you've seen in your practicum? How do you assess or accommodate for cultural differences in the practice? Has anything or would anything make you uncomfortable? And what is one cultural difference that more people need to be aware of? Now, you know that I'm more interested in quality than I am in quantity. But as long as you have answered all of these questions well, that's good enough for me. I don't expect like 4 pages for something like this. Answer those questions well using scholarly language and proper punctuation in APA format. And so this is an assignment you don't need to respond to your peers, but in the practice case scenario, you do. So one step closer toward the end of our time together. If you have any questions or concerns, please feel free to reach out to me, and I'll get back to you as soon as possible. But for now, I'll see you in the posts.